hurry up.
You can't have the mic.
Yeah. All right, then now we can move on to our session 3. We've looked at workplace health and safety issues in session 1. And in session 2, we've looked at other formalities. And session 3. Now, in the beauty industry, skin probably is the most talked about item. I mean, that is the reason that beauty industry exists. It's all something to do, it's all to do with skin. Looking after skin, products for skin, skin treatments, that's what we are in here for. I've just got a few of my notes here, I'm going to go by my notes as well. And so this is the main focus. Skin is the main focus of beauty industry. Skincare makes up about 31% of the cosmetic market, which is quite a big portion. Now, when I say cosmetic market, it includes hair, makeup, and skincare. Skin is the largest organ on our body. So we always looking after our skin, exfoliating, tanning, putting products on. But there's a lot of emphasis on the face, mainly with female consumers. We mainly focus on face. Skin is the largest organ of our body. It makes about 16% of the body weight. And the idea about learning about skin is to learn how it functions and how you can improve the look of the skin, how you can meet clients' needs. It is as well as knowing your products and all the other things that come with beauty industry. You need to learn about anatomy, physiology, bacteriology, as well as the skin. Skin is the main reason we are here in this industry. So starting with our skin, as you can see that I have got a diagram here, a cross-section of skin, and it shows you all the skin layers, and we are going to be looking at them, dissecting them. If you look at a skin, it's about 1 millimeter thick. So this section here is cross-section of a 1 millimeter thick skin. So you can imagine how complicated that 1 millimeter layer is. Now, skin includes your hair. Hair is one of the appendages of skin. So we are actually born with hair on our body. We have all the follicles on our body that we need for the entire lifetime. But when we are born with a very fine hair, which is called lanugo. And over the years, as we get older, the hair becomes coarser and thicker. And then some areas obviously have more hair, like armpits, pelvic area, we have more hair. On the body, we have less. Some people have less hair on their body, some people have more hair on their body. And also, hair follicle is part of the skin appendage as well. Then we've got another appendage of the skin, which is our nails. They are made with hardened keratin cells. And then we also have skin receptors, which the skin receptors are there to relay messages to our brain. So that's how we feel heat, cold, touch, pain. If we prick our finger, we immediately remove our hand because the receptors sending message to the brain saying there is a problem here, so we quickly remove our hand from the danger. Now, just to give you a little bit an idea of how receptors work on our body, even things like, we're talking about articular muscle, they are joined with our hair follicles. So when we get goosebumps, the contraction of the articular muscle makes the hair stand. So that's what it looks like. So we look like we have goosebumps. So I've got a video here that I want you to watch. It is a little bit of fun video, but it gives you an idea of what the muscles can do. It's only about 3 minute long video. Would you mind putting a radio? Yeah, you can compress. So there you go. So you will learn how the erector pili muscle works. So we can just put that there. So just to show you, because the video wasn't all that clear, and also the sound was a bit poor. So let's just pretend that we have a cross section of our skin here. So this is our skin, this is the hair follicle. So this is our skin, and then the hair is coming out of this follicle, coming out like that. Now, okay, and then this is your articulate muscle, which is connected to your, so let's just be a little bit fancier here. So what happens is, like when this is contracting, it actually makes the hair stand. So that's what happens when you're getting goosebumps. So when you react to fear, danger, cold, that is what's happening. The erector pili muscle is contracting, and it's making the hair stay straight. And obviously, like the video said, we don't have much function. We don't have much function of goosebumps, but in our caveman stage, we would have used that as a defense to make ourselves look bigger. So when you have your cats at home, when they get scared or they get angry, they immediately spread their head and they make themselves look really big. So that's what happens. So even with temperature, if we put our finger in a hot water, we immediately remove our finger. When we get cold, we put a jumper on, because these are the receptors sending message to your brain that you need to act. Pressure, if someone is pushing their finger into our skin really hard, we're going to feel that and we're going to react to it. And also, we have the receptors for pressure. For example, people who read Braille, I mean, these are little tiny bumps, but they can actually read with their fingers. That's how sensitive these receptors are, that they send the messages to brain. So after that, we're also going to look at some skin glands, So we're talking about sweat glands, and we're going to talk about sebaceous glands. Sweat gland is, I think we all know, they secrete sweat, and they're also called pseudoferous gland. Now, some of these names have been taken by Greek language as well as Latin. So the names are very different to our everyday names, but that's why, because pseudo meaning sweat in Latin. So they're called sweat glands or pseudoferous glands. So in that we have eccrine sweat glands. So what the eccrine sweat glands have, really watery consistency sweat. So that is the sweat your body secretes when you're feeling hot. So it can cool down and your body temperature can come down to cool your body. And they are distributed all over the body. So we've got apocrine sweat glands. They are limited to certain areas. So we're talking about underarms, pelvic area, scalp. Those glands secrete like a waxy substance, which doesn't have any odor. It's only the bacteria that gets mixed with that and produces odor. So when we talk about smelly underarms, it's not the sweat itself. It's actually mixed with bacteria, and that is what causes the odor. Then we have sebaceous glands, which secrete oily, waxy material, which is called sebum. And hormonal activity in body can produce, an increased sebum, like especially with teenagers, they have extra sebum because of the hormones and everything. The sebum production is increased, and then obviously they get acne and things like that, because what happens is with the sebum, it clogs the pores, and the blockages in the pores can cause acne, and that is why acne is probably more prevalent in teenagers and young adolescents. And they also have function of waterproofing the skin. Sebum in our skin is good because it is a natural moisturizer. It actually helps keep your skin moist, but also in excess it can cause problems. So it is always a balance that you have to find in between, keeping enough sebum on your face to keep your face looking nice and young. And then we're looking at skin layers. So we have 3 skin layers. The top one is called epidermis. The first layer is called stratum corneum, which is made out of all dead cells. They're called corneocytes. And their function is to protect the layer underneath from infection and dehydration. So this layer is always constantly shedding dead cells because your cells are always renewing themselves. So as they're getting pushed up, the top layer forms a dead layer, and then obviously those cells fall off and then the new ones come up. And that is one of the reasons in beauty industry we look at exfoliation, to remove the dead cell layer, because that can cause blockages on the skin, or the skin can look dull and sallow. So the idea is to remove those dead skin dead skin layer to bring out new skin. I mean, you will know when you look, if you look at your bed sheets under a microscope, you will see millions of these cells. You're shaking your head, you don't have cells. Because you don't have a microscope.
I watched them every day.
But actually, our body sheds, I'm pretty sure it's like quite a few thousand cells. I've got it in my notes per minute, you know. So, because it's forever renewing itself. So, yes, there are dead cells in your bed. Sorry to say that.
You won't share more about
The layer after that is called stratum lucidum, which is like, it is like a transparent layer. It's thin, clear layer of dead skin cells. And they're mainly found in thicker skin, like the palms and soles of your feet. After that, we have stratum granulosum. Granulosum meaning round, like grain. They look like grains. That is the middle layer out of the 5 layers in the epidermis. What their function is to create barrier between the 2 layers. And also, working as a water barrier. So if something does come through the first 2 layers, there's not the barrier. So it's like a filtering system in your skin. So it's forever filtering whatever's coming through. Sometimes it does let out substances in your skin, and that is something is used in beauty industry. You know, in beauty industry, you have machines that allow some products in and prohibit some products from entering your skin. And that is the skin science that they have used. The information from this they have used to treat the skin, to obviously enhance its appearance. And then we've got stratum spinosum. Spinosum meaning a spiny looking layer. Obviously it's a Latin name. Because it's like a spiny little layer, it works like a microfiber. So microfiber, like we've got a microfiber cloth, they actually made to stop the bacteria from getting in. So that's what their function is, like they stop the bacteria from getting into the skin. Then we've got the bottom layer, which is stratum basale. It's also called the stratum germinative. It's a single layer and it's a cuboidal looking layer, so it looks like little cubes. So if you're looking at a diagram of that, so you would be looking at that layer of the little cubes, a little chain, and they're also constantly dividing and replacing themselves. Then you've got the epithelial cells. They're found in connective tissue, epithelial tissue, muscle tissue, and nervous tissue. After that, we have the second layer.
Can I ask a question?
Yeah, sure.
About warts. This is a part of your skin attacking your skin.
Yeah.
How they're coming in your skin, and how deep they go.
Okay. That is, see, when you go into looking at those sort of conditions, that study goes into dermatology. So, beauty industry, it's mainly learning the functions of the skin. And we will look at some disorders. We do learn about warts, but if you want to go in depth study with warts, you have to go into dermatology. Obviously, we don't cover that part. So, if there is something foreign on your skin, obviously it is some kind of infection. Yes. So, and I mean, warts are viral and they are contagious. So, if you do have a client with warts, obviously you're not going to treat them because they can spread. So, it is a viral disorder. That is something that we have to look into. with dermatology, unfortunately. Yes.
20.
20 minutes, yeah, okay, thank you, cameraman. Yeah, and then in the dermis we have two layers. We've got the, actually this is the most important layer for us ladies because this one's got the collagen and the elastin, the most collagen and the most elastin. But that is the two C word and the E word that women are interested in. You know, a product that builds collagen and elastin, they are our best friends, aren't they? Yeah. So this is the layer that's got the most of collagen and elastin. Now, papillary region is one of the sections of this dermis. They contain the capillaries and nerve endings. Not much to talk about the two, so we can move on to the next layer, which is the second one is the reticular region. It's a thick network of collagenous elastic reticular fiber. It actually contains hair root, sebaceous glands, sweat glands, receptors, and nails have nails and also blood vessels. There's a lot happening in this second part of the dermis. Okay? And then we've got the hypodermis, which is the bottom third layer from the top. It is also called the subcutaneous layer. It lies between dermis and underlying tissues of the organs. So you can see that that's where it starts connecting with your organs. So you've got all this, we've come down from the 5 layers, 3, and then the bottom layer now. We're getting closer to the organs here. So then we've got the, it actually provides insulation as well, function of that hypodermis. So in that we have two types of tissues in that third layer. We've got adipose tissues and we've got areolarous tissue. The first one, adipose, is the fatty layer. It's a loose connective tissue comparing to the composed of adipocytes, and their function is to store energy. So as we know that if you do move to colder climate, we do put on a little bit of weight because your adipose tissues are getting ready to produce energy to keep you warm. And areolarous tissues they bind the skin to the muscles beneath them. So moving on to something a little bit more exciting, the skin functions. I hope you find that more exciting. Now, there are several functions skin has. It's about 7-8 functions, depends on how you look at it. But the main function is obviously to protect the body from water loss. If we didn't have skin, we will be losing water very rapidly. So the skin is working as a barrier and it protects us from UV ray. Now, when I say that, it does protect us from UV ray, but obviously in excess, then we see the bad outcomes of excessive UV rays. But it is, the main function is to prevent excessive water loss and protect your skin from UV rays. And also it protects skin from harmful bacteria, invasion of bacteria. So I mean, most of the time if we do get cut or something and then we get infected, we have to have a good reason for our skin to get infected. Otherwise we won't just go and start collecting bacteria and getting infections on our body. There has to be a good reason why your skin reacts to something. And then, it also protects you from injury, trauma. I mean, it does work like a barrier from all those things. I mean, obviously not from a severe trauma, but yeah, if you do bump your hand all of a sudden, you might get a receptor telling your brain, yes, there is pain, but you're not going to fall apart just by hitting your hand on something. So, yeah. Or if you're a drama queen, you'll be going, oh my God. So, a response to external stimuli like heat and cold, like we discussed earlier on. Sensitivity, skin sensitive organs, they identify pain, touch, heat, cold, like we discussed before. And then also sensation as touch, pressure, pain, heat. Okay. Then secretion. So obviously we discussed secretion before when we discussed the sweat glands. So we talked about the sweat glands, and we talked about the sebaceous glands. Sweat gland is obviously secrete sweat to keep you cool, and sebaceous glands secrete oily substance called sebum. Excretion. So with excretion, as well as keeping our body cool after sweating, sweat is there to also excrete any toxins out of your body, any unwanted things, so that's one way of body getting rid of stuff all the time through your sweat. Absorption. So like in beauty therapy, that concept is used to benefit clients. Absorption, like there are methods of having products absorb in your skin, and obviously, like there's things like iontophoresis, and iontophoresis is actually done with galvanic machines, which you will be learning in the later part of your studies. Galvanic machines they have the electrodes, you get positive and negative, and they are applied to your skin, and that creates an chemical action in your body, and it helps body to allows skin to absorb the products. So they will put the products in your skin, and they will roll the machine, the galvanic machine or iontophoresis machine, and that will help get the products in your skin. So that concept is used in treatments as well. Respiration. With respiration, with our skin also breathes, as well as we're taking breath. So it's also emitting carbon dioxide and taking oxygen. Now, after that, so I hope I'm not going too fast for anyone.
No.
Is everyone okay out there? They're understanding what I'm saying? That's
You're
good.
not falling asleep yet.
Oh, that's good. How is the camera?
Bosses look for you.
Yeah. How are we going for time?
27.
Okay, 27, because I'm sure you all want to take a break soon, so we'll just move on to our next bit. Excuse me. So we're looking at also skin disorders, so that is very important. When you're treating a client, and you want to make sure that they don't have any skin disorders that can affect a treatment, or that can prevent the treatment, or you might have to not do any treatment depending on what the problem is. Erythema is caused by reddening of skin. Some clients can get erythema after the products are applied or after the treatment. It's just that their skin is more sensitive to touch, and that can cause reddening. And sometimes you might have to just use cooling products, and you might have to adjust your treatment according to their skin needs. And if it's really severe, then obviously you are to be very careful. It can be caused by infection, it could be hereditary, they could just have very fine skin. Then we have rosacea. Rosacea, it's very common disorder. You can see the reddening around the nose, cheeks, also chin area. It is caused by expanding blood vessels. So most of the blood vessels which are concentrated in these areas, they have expanded. In many cases, it is caused by excessive heat. If someone has been spending a lot of years in the sun, so what has happened over the years, the vasodilation has made the capillaries expand, contract, on so often that they become weak and then they stop functioning. So the capillaries stay dilated all the time, and then there's reddening on the skin. So then we've got dermatitis, because some of these dermatitis things, so dermatitis, people with dermatitis, you have to be careful when you want to treat them, because you might aggravate the condition. Eczema, that's like a chronic skin condition. You will know if someone's got eczema, that there are red scale patches on the skin. The eczema can be sensitive to products. So, did you have a question?
Yeah, it's no good if you see somebody with eczema, you don't touch them.
Yes. You can do some treatments, but you have to be careful.
Did you touch somebody with warts?
No, if we do have clients like that, in some cases we wear gloves to treat them, and you can still get around treating clients with contagious diseases or disorders, but that is why you do the client consultation, which you're going to learn later in the program, that how you will do a client consultation, because that is when you determine whether you need to adjust your treatment, and then you have to ask them questions and examine their skin. So that is why we have all these equipments. We've got the magnifying lens, so you're going to look at the skin, ask them questions, and you hope that they're going to give you all the right answers. There's always a small risk you take, but
And you refuse to touch?
yes, you can refuse service to your customers. If you feel like your health is in danger, you have the right to do so. You can try and treat them with gloves on, if they're okay with that, because you don't want to disappoint them. But if it's really severe, like if someone's sneezing, coughing, or if they're intoxicated, or if they're under the influence of drugs, obviously you're going to be thinking twice. So you can come and sit down. And your son can come in too if he wants to sit. Just tell him to sit on that side. And then we've got folliculitis. It's a hair follicle getting infected. I'm not sure if anyone's suffered folliculitis, but it can happen when your hair follicle gets infected, and it can be very, very painful, and it can leave scars. Obviously, it's not contagious. You can still treat a client with folliculitis. You just have to be careful, because that will be a very sensitive area. Then you've got melia. Many times we see little bead-like things around our eyes, nose area. They're not whiteheads, they're melia. They're filled with, they're like keratin-filled cysts. And then you've got your comedones, which is your common blackhead. So you've got closed comedones and you've got open comedones. The black tip of your comedone, well, it is almost a white hair turned into black hair. Chili, did you want some water? Yeah, there's a glass under where the grapes are on the right side. Yeah. And then there is a water fountain just over there next to the fridge, that side. Yeah. And so it's just a white head, but what happens is on the other side of the wall, to the left, yeah. Sorry, no cold water. Yeah, so what happens with the white head, it actually comes in contact with the air, and then with the oxidation, it actually turns black. So that's what we call a blackhead. It's got a head that's black because of the oxidation. So you can have, it's actually a blocked sebaceous gland. So your sebum, when you have excess sebum, it's blocked, and then this is why beauty treatments are important, to remove all the extra sebum and things like that, so that it doesn't cause blockages. And then obviously we've got the whiteheads that pretty much similar to blackheads, but a stage before that. They just block sebaceous ducts. And then the biggest thing out there is the acne with our teenagers. We have adult acne. We have acne even in adulthood, especially caused by hormones and things like that. But it is more prevalent in teenagers and at puberty time. And so it's obviously caused by extra oil production and dead skin cells, and then the combination of the two, clogging the pores, and mixed with bacteria is a deadly combination. So even touching your face with dirty fingers can introduce bacteria on your skin. So in acne, you've got 3 different types of acne. You've got papules, pustules, and macules. So I'll look at my notes because I've got them written here. So papules are the red bits just under the skin. You can see the little bumps. Then you've got the pustules, which is more commonly known as pimples or zits. With those, you need to allow them to heal naturally without stitching because you can cause scarring. Then macules are the ones that leave a little mark while your acne is actually in the healing process. So that's the one that you want to pick at, which you shouldn't. I don't think any of you know because you all have beautiful skin. Then we have boils. We're talking about skin disorders. Yeah. Then we have boils. So we have skin infection. That is what causes the boil. And it actually can start in your hair follicle or the oil gland. Then we have psoriasis. It's non-contagious, so there is no need to be alarmed when you have a client with psoriasis. So these are like scaly, patchy skin. And it is actually caused by release of inflammatory chemicals in the body. So, you might have to just alter the service according to, if they have it obviously all over their face, then you're going to think twice about treating a client with psoriasis. Then you've got ringworms. Now, it is infectious, so if you have a client with ringworm, you'll be very, very careful. Now, it's nothing to do with worms. It just, because it's round and it appears like a worm that is a ringworm, it's called ringworms, but it's not, it actually is a fungal infection.
And do you treat them when they have that? Or do you
They have to go and see a doctor for that because it is a fungal disorder, so they
don't
don't.
treat them?
No, because it can be very contagious. Yeah. You can treat them with gloves on if they have it on their face, but then you have to make sure that once the client has left, you clear the bed and you wash the sheets, the towels and everything really well with disinfectant. And then you've got things like vitiligo. Vitiligo is it's a people have white patches. It's just missing pigmentation, unfortunately. So the pigment is missing, so it causes the skin to be lighter than the other side. So then you've got chloasma or melasma, which is also formed by hormonal activity. So mainly in women during pregnancy. It's also called pregnancy mass. So it is usually more prominent on the cheeks. See, you might get that. So how are we going for time? Okay. So these are all the skin disorders that you might come across. And then obviously, the 3 things, the main things that we look at, obviously we'll be studying further later on. Collagen, elastin, and keratin, like we talked about earlier, very important to us ladies. Collagen is found in dermis, which is the middle layer. It is actually a protein, and that is probably the most abundant protein in our skin. As we age, obviously collagen production is reduced, so that's when we have alarm bells going off, we run to the beautician and get all sorts of treatments done. We buy creams with collagen in it to treat our skin. So, and that's where our study comes in, because that's where we can help our clients with the correct treatments. Then we have elastin. Elastin is exactly what it sounds like. It's like an elastic. So when we're younger, when you pinch your skin, it goes straight back because of the elastin. But as we get older, it's okay to go a little bit over. As we get older, we lose elastin in our skin. So what happens is, like when you pinch your older skin, it takes a little bit longer to spring back. No, we are not talking about your skin. You got beautiful skin, that you don't have to worry. We're talking about really, really old. So this is also a protein and found in dermis. So as we talked about it earlier. Now, keratin is the strongest protein out of the three. It forms nails, strongest meaning in strength. It forms nail, hair, and rigidity of skin. So if you have hardened skin, like especially on the heels of your foot, you've got hardened skin. So that is caused by keratin. And your nails, and also your hair. So that is a little bit about collagen, elastin. And then also, when we're looking at skin, when we are treating clients, we are going to learn more about skin as we go along. Today, just the overview of everything we are going to learn. We are going to sort of go through every single thing one by one in our studies. But when it comes to skin, we also, the main thing we look at when we're treating a client is, like, obviously we don't go in depth of looking at this when we're treating a client. When we're treating a client, our first thing to determine the skin, whether it's a normal skin or oily skin or dry or combination, sensitive, mature, a cuporous skin. Cuporous skin is the one with capillaries on the cheeks, and so you can adjust your treatment according to what their skin type is. So that's something you will be looking at into. So if you're looking at normal skin, it's more balanced. It's got a healthy glow on it. So and obviously there's no present acne or anything. So when you look at someone's skin and it's beautiful, you know that they have normal skin because it just looks so perfect. Then you have your oily skin. With oily skin, you're going to get open pores. Because what happens is, with the pores, when there's a lot of oil production being made, the pores are overworking and they enlarge, and then sometimes they just don't go back to the normal size. So they stay enlarged, and then it is a very common trait of oily skin is enlarged pores, and also oily skin has a tendency to get acne. There is a good news for oily skin though. People with oily skin will look younger for longer than people with dry skin, perhaps, because they've got that natural moisturizer flow in their skin. So they usually keep their skin younger looking longer than people with dry skin. Then you've got dry skin. Someone may have really dry skin, it's dehydrated. It could be caused by internal issues, things like they're not drinking enough water, things like that, They might be spending a lot of time in the sun, so it's called dehydration. It's like scaly, and because there's not enough oil production, what happens is like that. Unfortunately, that skin is prone to get wrinkly sooner than it should. So obviously, the emphasis in beauty industry is to keep the skin moist all the time, hydrated, well exfoliated, well looked after, and that is what it's all about. Then you have combination skin with the T-zone. So it's called T-zone because this is the zone, you've got concentrated sebaceous gland here and here. So you've got the oily T-zone. Just because you have oily skin, that doesn't mean anything, because you could have dry patches on the side. So you could be oily and dehydrated at the same time. Sensitive skin, someone with really fine skin, it could be hereditary, especially the Northern European skin is quite fine. It's easily irritated, so obviously when you treat a